Welcome to St. Paul's Hospital Atrial Fibrillation Patient Education video. In this module, you will learn what is an atrial fibrillation ablation, care for going home after an AF ablation, what to look out for after the AF ablation, and when to seek out help. An ablation is a medical procedure used to correct specific heart rhythm problems such as an atrial fibrillation. It restores the normal regular heart rhythm by scarring tissue that triggers the abnormal heart rhythm. Before you left the hospital yesterday, you got instructions on how to take care of yourself at home, what to watch for, and who to follow up with afterward. In order to care for your wound, you will need to check your groin site 3 to 4 times a day for signs of bleeding or swelling for the next 3 days. It is important in the next 7 days that you take showers and avoid going in baths, swimming pools, or hot tubs to allow the leg wound to heal. Do not lift, push, or pull anything over 10 pounds, such as a child, bag of groceries, or laundry baskets. This allows healing of the blood vessels in your leg. You will want to avoid strenuous activities. You can return to your regular exercise, including sexual activity, in 1 week. Again, this allows the blood vessel to heal. Bruising, soreness, and swelling around the insertion site are normal and go away in about 2 weeks. If the lump to the incision site gets bigger or harder, this is an indication of bleeding. If this happens, lie down and apply continuous pressure with your hand for 15 minutes. If the bleeding stops after 15 minutes, stay lying down for 2 hours and check the area every 15 to 30 minutes, ensuring that the bleeding has stopped. You need to go to the nearest emergency department or call 911 if the bleeding does not stop after 15 minutes or you notice an increase in redness and swelling and feel warmth around the insertion site. This could also mean a sign of infection. What to look out for after the AF ablation. Heart palpitations. Having episodes of irregular heartbeats, either skipped beats or atrial fibrillation, can be common after an ablation. It is normal to experience continued symptoms of irregular heartbeat, also called arrhythmias, for the first 2 to 3 months after the ablation. During this healing period, the lining near the areas of the tissues that were burned is damaged from the ablation procedure, leading to swelling. This swelling can trigger more irregular heartbeats. However, as the heart tissue heals, it will go away in most cases. There can also be episodes of irregular heart rhythms that feel more pronounced, different, or even subtle compared to your previous episodes before the ablation. It is important to call the Atrial Fibrillation Clinic when you are experiencing prolonged episodes of irregular heartbeats, either skipped beats or atrial fibrillation, or moderate symptoms, such as an episode of atrial fibrillation that lasts for longer than 24 hours or makes you feel unwell or uncomfortable when resting. It is also important to go to the nearest emergency department or call 911 if you are experiencing severe symptoms, such as significant worsening of heart palpitations, or you have signs of stroke or a mini stroke, such as facial drooping, difficulty speaking, or understanding speech, or having the worst headache of your life. Chest discomfort or pain. After the procedure, the lining of the heart can also become swollen, irritated, and inflamed. In some people, this can result in a sharp pain that worsens with lying down flat or on your side, but improves as you sit up or lean forward. It can also be worse with deep breaths. The inflammation of the heart lining is called post-ablation pericarditis. Importantly, this pain does not indicate a heart attack. A medication that does not interfere with your blood thinner will be prescribed to treat the inflammation. You might also notice some mild burning or discomfort in your chest right after the ablation. This is common and goes away in a few days. It can be treated with regular acetaminophen. You should also avoid taking aspirin, ibuprofen, Advil, Motrin, or Aleve, as these are medications that can cause bleeding. It is important to remember to call the Atrial Fibrillation Clinic if you have a fever over 38 degrees Celsius or 100 degrees Fahrenheit, or you experience chest discomfort or pain as it was described. You should also go to the nearest emergency department or call 911 if you are experiencing severe symptoms such as really bad chest discomfort or pain, or feeling extremely unwell. antacid medication. Your doctor might ask you to take a medicine to reduce stomach acid. This is for added protection of your esophagus, also known as your swallowing tube. This can rarely be damaged after an ablation, as it sits right behind your heart. Usually, you take it for a month after the procedure. It is important to remember to call the atrial fibrillation clinic if you have heartburn, and you should go to the nearest emergency department if you are experiencing severe symptoms. Trouble swallowing, difficulty speaking, or throat discomfort. Very rarely, the ablation procedure can damage the swallowing tube or esophagus. This is called atrioesophageal fistula. Call the atrial fibrillation clinic if you have pain with swallowing, and you need to go to the nearest emergency department if you are experiencing severe symptoms. Shortness of breath. During the ablation procedure, there is a fluid given intravenously for medication administration and to maintain sufficient volume throughout the body. The extra fluid can occasionally cause pulmonary edema. Rarely, it can have pulmonary complications. It is important to remember that you should go to the nearest emergency department if you are experiencing severe symptoms such as you are short of breath even when sitting still, you can't stand up because of feeling lightheaded, or you have fainted. Important to remember for the next 8 weeks. Do not allow anyone to put anything down your esophagus. This includes procedures such as a transesophageal echocardiogram, also known as a TEE, or a gastroscopy. Continue to take your heart medications as prescribed. It is important that you do not miss a dose of your blood thinner. When receiving medical care by another doctor in the emergency department, it is very important to tell your doctors you had an atrial fibrillation ablation. If you have any additional questions or concerns, please call the Atrial Fibrillation Clinic at 604-806-9475. If you are unable to speak to someone at the clinic, you can also call your heart doctor or family doctor. Or call HealthLink BC at 811 any time of the day or night to speak to a registered nurse. Thank you for watching.